Time now for Better Health this week, health expert Beth Coker talks about the importance of colon screening.
Each year, 150,000 people are diagnosed with colon cancer. It's the second leading cause of death in the United States, yet it's completely preventable thanks to a colonoscopy. A colonoscopy is a common procedure doctors use to detect and remove polyps. These are small, non-cancerous tumors that grow on the inner lining of the colon and rectum. They're more common as we age and in people with sedentary lifestyles, diets low in fiber or high in fat, or who have a history of inflammatory bowel disease. And if left untreated, certain types of polyps can turn into cancer. The key is to find them and remove them before cancer develops. The procedure is done under sedation while a specialist inserts a scope through your large intestine to check for polyps. Doctors can actually remove the growths during the procedure, which may eliminate the risk of cancer or catch it at its earliest, most treatable stage. A colonoscopy is painless and highly effective, and it is recommended for most people starting at age 45 or earlier for those with high-risk factors, such as a family history of colon cancer. If your initial screening shows no signs of risk, you may not need another exam for 10 years. The American Cancer Society recently updated its recommendations for colorectal cancer screening, changing it to age 45 because recent research has found that new cases of colorectal cancer are occurring in younger people at an increasing rate. Since colon cancer often shows no early symptoms, the only way to detect it is with a screening exam. There are a few options for screening exams, and you should talk with your provider to determine which one is right for you. These exams are recommended every 5 to 10 years after the initial exam at age 45. In addition to the colonoscopy, some stool-based lab tests are also available to help detect signs of cancer. For people at higher than average risk, including those with a personal or family history of colorectal cancer, polyps, or inflammatory bowel disease, doctors may advise getting screened earlier than age 45 or more frequently once you reach your 40s and 50s. Talk with your primary care provider about which screenings are right for you. Don't put it off. Early detection can save lives. And for more information on a colonoscopy, visit health.asante.org.